It is right at 10 a.m., so we will begin. I know some people are still joining, but we will get started. Welcome to the monthly GHA Analytic Advantage User Group. This user group is an open forum to provide updates and information to users and is an open forum for users to ask questions and give feedback. Please keep your microphone on mute if you're not asking a question to avoid background noise. This Zoom meeting is being recorded and will be available for viewing on the GHA Data Services resource page. And with us today, we have, as you can see, we have our videos on. Leslie Stainovich, Sharifa Navos, wave, Bill Wiley, Stephanie Taylor, and Samantha Dulworth. And if you would like to turn your video on, we'd love to see your face as well. So we have a brief agenda this morning. We're going to talk about an update on the 2020 data submission and how it's going so far. Updates and plans for the visualization tool, limited data set access for subscribers. And there are, you should have received an email, most of you, yesterday or day before yesterday regarding new member reports for finance in the finance category and quality. And then also there's some new pretty dashboards Stephanie developed for COVID-19 that she's going to go over with us. So with that, we'll just go in and jump right in. Let me admit a few more people. Here we go. As always, I'd just like to give a brief overview of what the Georgia Discharge Data System is, especially if we have any new users. It's always a good refresher. Hospitals submit their UB data to our vendor, Heidi, who is a subsidiary of the Missouri Hospital Association, and they have been our vendor for over a decade. We have been successful in having a monthly data submission for the last 2 years now for most hospitals, and that data is processed by Heidi and becomes the Georgia Discharge Data System, which requires the state mandate of submission of data for inpatient and outpatient to the state. GHA then receives that data, and on your behalf, we submit that to the Brain and Spinal Trust Fund Commission, to the state of Georgia to fulfill that state mandate, to the Agency for Healthcare Research and Quality and the Healthcare Cost and Utilization Project. Both of those help us to monitor and manage any data research requests and make sure that those are in line with what is in the best interest of our members. Sharifa, do you want to quickly talk about the GDDS schedule for 2020, and then we also have the 2021 schedule available, and give us an update on data submission?
Yeah, no problem. Good morning, everyone. As you know, the October data will be due in December 15th, so in a couple of weeks, and so we I guess a few years ago we switched to a monthly submission with a couple weeks of I guess wiggle room to give you to submit your monthly data. And if you participate in Quality Works, it would be November data due on the 20th of December. So for all the Quality Works participants, make sure your data is submitted on time. And since this happened, since COVID I guess happened in March, we've been working from home, and I've seen a seamless transition in data submission. So I'd like to thank all of our data submitters for being on top of everything, making your corrections. We've had a few hospitals that we contacted over some invalid payer code errors in their data, and they were able to resubmit that data. And so we just refreshed quarter 3 2020 data, and that should be released soon. So that new corrected data that was resubmitted will be part of that. And I appreciate everyone who looks at the data and who lets us know if they see any type of distribution or volume or any type of issues, so that we can go in there and make corrections. Also, for our HeidiNet users, the people who submit the data, just be reminded that a verification report is generated every time you submit your UB file, so your data file, and it's good to look at that report. It gives you a good overview of what your data looks like, what your trends, your distribution, your volumes look like. And of course, the volumes have been, it's been challenging, especially around April, May, June. And we see that numbers are kind of coming back to normal for most hospitals, for most facilities. And for others, it's still a little bit below the average, and we're also monitoring that as well. And Stephanie will be talking about that a little bit later. So again, thank you for submitting on time, and the schedules can be found under the data resources section on the GHA website. We'll upload that as a PDF, and you can use that as your reference. This is a 2021 schedule. So again, it's a month away plus 2 weeks. So January will be due in March, February in April, and so on. So any questions about that?
Please feel free to
email me.
Type a question in the chat or unmute your mic or your phone. If you have a question, this is your forum. All right, then we will move right along. We do have a meeting every month with our visualization tool vendor, Javion, to talk about the feedback that you provide to us, mainly from these user group meetings. And so we did hear from you, and I think it was on last month's call, we talked about the DRG code being added to the market trend analysis tab, and that is in the works. Also, the physician NPI to be added to the export data tab. And also Sharifa developed a DRG code grouping just as a reference page. Then that will be added to the README tab as well. And I believe, Sharifa, correct me if I'm wrong, but we anticipate those updates being implemented with the Q3 data release in mid to late December.
Yes, correct.
Look for those updates and give us your feedback. If you have any questions, let us know. Also, we started kind of talking about goals for 2021 to improve or enhance the tool. And we heard and have been hearing you loud and clear that having a filter saving option is very important, and we recognize that, and that is a #1 goal for us to have that develop sometime in 2021. We also are working towards a monthly data refresh for the visualization tool, and also self-serve password reset so that you don't rely on us having to resend the password, that it's a self-serve process. Any questions or feedback here? And in the chat, I don't see anything. Anyone? All right. I did piggyback on that. The Q3 2020 limited data set, for those of you who subscribe to the limited data set, that is available now, and we are implementing a little bit of a new process. You have been receiving a link from me, which is a link to Box, which is a secure FSMA compliant cloud-based tool to house the data. And one of the reasons we do that is it is secure, and it has tracking logs, so we are able to manage access to the data. What we're doing now, instead of me emailing you a link to that data each quarter, what I am going to be doing, and you're going to receive this email that you see on my screen now, you're going to receive an invitation from Box to be a viewer uploader to the 2020 folder. And the 2020 folder will contain the most recent data release. So I've removed the Q2 release for 2020, and I'm replacing that with the Q3 because it's a rolling quarterly release where you're able, it'll have the January through Q3 data refreshed, the most up-to-date data. So each quarter you will receive an email from me saying the data is present, and you'll use that same access, that same link, and the password will be included in that email. For those of you who aren't familiar with what the limited data set is, the limited data set is a de-identified statewide database that is available for an annual subscription fee. If you're interested or you have any questions about that, please let me know. It takes quite a bit of staff time to, at a facility to manage that data, to house that data. So it's not appropriate in every setting, but some of the mid to larger hospitals utilize that data set, that subscription annually. Any questions about the limited data set or access to the data?
Has everyone used Box? I know we've used it several times, so I just want to make sure everyone's able to get those links. And you don't have any firewall issues. I think we worked through all that the last time.
Absolutely. If you have difficulty or for some reason you don't receive that email, this email will be going out later today, and your invitation to be a viewer uploader will be going out later today as well. So if you don't see anything, say by noon tomorrow, you may want to check your spam or junk folders, because many times it will go to that, and then you'll have to, or your quarantine, and you'll have to release it. But always feel free to give me a call and ask if that has been provided to you. And I also need to be kept up to date if a user, is no longer with your facility, or we allow 2 users to have access to the data per facility, or per subscription for systems. So, and that's just to, really be protective of and keep a tight rein on access to that data. All right. Bill, you want to share with us some updates to the member folders?
Yeah, I'd be more than happy to. You should have received the email Monday about the new reports that we've uploaded. One in the quality folder is really a reference guide. I actually print it out and keep it up there because it tells us what some of the baseline data timelines and things like that. It's about a 6 or 8 page PDF that really just gives all of the different Medicare quality programs, where they come from, the data that's used for each one, and the timing for each. So it's actually a very good reference guide. The 3 others that we posted are all in the finance folder. One is the cost report model that has Q2 of 2020 data. That is important because there are a number of programs out there that use your annual cost report. So make sure that that's something that's been updated correctly in CMS. And it breaks it down. It has your most recent ones. I think it's your last 3, depending on which fiscal year it hits, but it's at least this fiscal year and your previous fiscal year. So you can go and see if there were any major changes in what was reported in your cost report. Again, there are a number of different reimbursement things that are utilized for that. The final rule for home health, any hospital that has a home health program, that was actually posted. I think that only is about 25 hospitals or so that have a home health PPS program, but that has been updated with the final rule for 2021. The one I really wanted to call attention to is the Critical Access Hospital and Small Rural PPS data book. That was updated with the most recent October data. It's actually uploaded as an Excel file because of some of the macros that are in there and some of the measures. It is a great tool for all of the middle-sized and smaller hospitals. Has an inpatient utilization, Medicare inpatient utilization, outpatient utilization comparison by significant product lines for majority rural hospitals. There's probably 10 or 12, and it compares it to state critical access, U.S. critical access, state small and rural, and then U.S. small and rural. Also a comparison of your case mix index by those same product lines. Same thing on the outpatient report. The real kind of meat to this are some of the financial indicators and performance indicators that are in there. This is the reason we put it in as an Excel file, because it has some dials that give you comparisons from that standpoint, above average, below average, things like that. The profitability indicators are really interesting for you to see as a comparison of where you are. It's a total margin, operating margin, the EBITDA margin, operating cash flow margin in comparison to everyone else. Then they have some liquidity indicators, again, current ratios, your average payment periods, days of cash on hand, net days revenue, and AR. Again, this is all coming from Medicare data. So it's stuff that's already been reported for you, and it's been updated with the most recent October release of that. And then lastly, there's kind of some capital structure indicators. It's things such as average age of plant, capital, what was this one? Capital expenditures as a percentage of depreciation. Again, it's just some measures that kind of give you of where you are compared to peers with keeping up with depreciation, debt to capitalization ratios, and then debt service coverage ratios and things. So it is a great report for really the independent standalone PPS and critical access hospitals. I think we have 58 hospitals that were underneath that report that have data in there and identified as rural or rural PPS. So I encourage you to spend a lot of time on that. It is a really, really good comparison for rural hospitals about where you fall compared to others. One thing I did want to touch on, we get a lot of these reports from a sister hospital association, Hospital Association of New York State, and most of them have been Excel-based with macros that we can run individual reports and post things like that for the hospitals. A lot of these quality programs have really started to bring in a lot of the data that Medicare has, and honestly, Excel may not be the way that they can keep up with it. So in 2021, especially with the quality reports, a lot of these are going to go to interactive HTML type user engagement, I guess is the best way to describe it. Everything on the back end is still, database management, things like that. But what we'll be able to post are really and truly interactive websites, for lack of a better description, where you'll be able to drill down through all of the value-based purchasing reports. I'm trying to think of the other ones, readmission reports that are out there. So you can really drill down into each individual service line. So they're going to be a lot more interactive. We're going to have to do some work on our side to make sure that we can essentially post websites into a website because they are HTML files. So we're going to do some changes on our side. But so knowing going forward in 2021, a lot of those reports that you're going to get, especially the quality ones, are going to be more website looking, website experience reports. And it will give you the ability, at least in the ones I've seen, that it will give you the ability to kind of download some of that data the same as our visualization tools do right now. So be on the lookout for those. Again, we're working to try to put those up in that format, but they will be a lot more interactive than just 50-page PDFs that you have to go back and forth through to make sure that they're all up and running. But that's a very exciting thing for us for next year. Any questions on the reports that have been posted? We'll get another batch in December, and we'll make sure those go out as quickly as they can. I know some folks want some year-end things that we also provide.
I don't see any questions in the chat.
Thank you, Leslie.
Teresa, do you want to just quickly let everyone know remind everybody how they can access those reports?
Yeah, those reports, just like the PDF of these presentations and the schedule and other forms like that can be found on the GHA.org website. And you would just log in to the website, and when you hover over the data tab, you would select Georgia Discharge Data System. That'll take you to this page. Now, you would need a special permission to see the member reports folders. And that should come from, and I guess correct me if I'm wrong, Bill, one of your C-level people to let us know that they want you to have access to those. So I guess you can always email me and let me know.
Yeah, correct. All of the C-level and a lot in rural areas of VPs and higher, CEO, CFO, chief quality officers, COOs, things like that, they've already been posted or given permissions. But anyone else, just let us know. We can get them added.
Right, and you'll be able to see those. You click on it, and then this shows you all the facilities. That was taken from an admin user, but you'll see your facility or your system and all the facilities under the system. Once you open it, you'll see the finance, different folders where different reports are. So finance was updated as well as quality this time around. So you'll be able to see the new folders in there. Some of them are organized by year, just depending, on how many folders there were. So, you'll be able to go through and go back to 2018, I think is, I guess the earliest. So if you have any questions too, or if you don't see your access, feel free to email me and I can work on that for you.
Thank you, Sharif. Any questions regarding the member folders? Great. Well, now I'm going to ask Stephanie if she will give us an overview of the COVID monitoring that she's been doing.
Sure. Good morning, everybody. Hope you're having a great day. Currently, we have COVID data through November 30th. As you can see here, we're reviewing the hospitalizations by date. However, at the end of November, where there's a drop-off, that drop-off may be suspect because it's within the 2-week window of reporting period, so it may end up higher. Additionally, I've added the correlation of new hospitals and cases, and I suspect because a number of these days that are below the trend line, once the data is resolved for the last couple of weeks, it will end up looking a little bit tighter. But there still is a strong correlation of new hospitalizations with new cases. And as you can see, we've had almost 70,000 people total hospitalized this year. Can you please do the next slide? And we have the data through August for both our inpatient and outpatient monitoring. As you can see, the length of stay is still pretty significant, and that definitely correlates with the spike we had of cases throughout the summer. The total patients discharged is still much higher than bottomed out when March and April, but it is still lower than our peak in January of where we should be. Additionally, with a month to go, here by the admit type, we're about 66% on all three of those. So we'll see what September brings, and hopefully after adding September, we'll be closer to Q1 and surpass Q2. And below that is the top patient service lines. And interestingly, pulmonary medicine has already surpassed in 2 months the entire Q2 period of number of patients. And the main service lines are trending to definitely become more normalized. Could you please do slide 3? Okay, and this is our outpatient data. Currently, we're still, if you look at the top, between August and February, we're still down 8.7% of total outpatient discharges. And if you compare August to January, we're down over 15%, between that time period. So hopefully we'll continue to see an upward trend of our patient discharges. And our patient types by quarter, our outpatients definitely picked up in ambulatory, but still our unclassified and emergency room patients are still emergency room patients are still looking down at this point in the quarter, down 50%. So it'll be interesting to see if those catch up. And finally, on the bottom right, we have some of our top procedures and the number of patients that we've had to provide those procedures for. In total, Q3 at this point is down about, Q3 is still down significantly from Q1. However, it definitely looks like we'll surpass Q2. And as you can see, mammograms are down significantly. And there's one, cancer chemotherapies are down. So, you know, the hypothesis that we will be seeing sicker patients in the near future is probably pretty accurate, given the less services we're providing. And does anybody have any questions? So hopefully next month we'll be able to provide this information with some context of prior years and develop a trend line to kind of see where we're going. And we will have the full Q3. So thank y'all.
Thank you, Stephanie. I don't see any questions in the chat, so thank you very much for that. Any other questions? We're at the end of our agenda. Anything else that you, the users, would like to discuss, or any feedback? All right. I have our user group meetings scheduled out for 2021. I have not sent out the reoccurring invite for 2021, but stay tuned. That will be coming soon, before the end of the year. That will be coming. So stay tuned for that. And we just want to say thank you and hope everyone has safe and happy holidays. We appreciate all of that you're doing for the state of Georgia, for our communities, and from a data perspective, we certainly appreciate your consistency and diligence in submitting the data in a timely and complete, and continuing to monitor the accuracy with Sharifa and working on any corrections that need to be made. We appreciate it so much, and please let us know if there's anything that we can help you with, do for you. If there are any special data requests or needs that you have that you're not able to fulfill on your own through the visualization tool, don't hesitate to reach out to me and to Sharifa. We'll be happy to assist you with that. And we just look forward to our continued working with you in 2021. And here is our contact information. And again, please reach out to us with any questions or assistance you may have. With that, we will end today's meeting, and we will look forward to talking with you in January.